So Frenchies, a little bit like all of the short-nosed breeds, or what we refer to brachycephalic breeds, have this very compact, short conformation, and that does make them predisposed to a number of hereditary disorders. The most famous one, and probably the most important one that we see clinically in practice, is what we call brachycephalic airway disease. And this is a syndrome where we have multiple areas where the airway is partially obstructed. And that can involve the nose, it can involve the nostrils that are simply too small, it can involve the soft palate where the palate is overly long and actually falls in front of the airway, and it can even involve the entire length of the trachea or the windpipe where the trachea is simply too small. A lot of these things can be seen at a very young age. So a little Frenchie puppy that has got overly small nostrils, or what we call stenotic nares, they literally have nostrils that are tiny little slits that they cannot breathe through. And those require surgical treatment. So you want to be sure that the airways are good. And in fact, there is a consensus statement which has come from the World Small Animal Veterinary Association advising breeders of brachycephalic breeds, and this is not just the Frenchies, it's the Bulldogs, it's the Pekinese, to select for a slightly longer nasal conformation to try and reduce the incidence of these particular problems. So I think brachycephalic airway syndrome is probably our most important condition that we see.